Good afternoon.
Afternoon, Doc.
Good afternoon po, Doc.
Okay.
Afternoon po.
So it's already 2 o'clock. We will start. Okay. So I'd like to welcome everybody. Please mute yourself, but always show your video picture. Sign in your name, your FB account, or email address in the chat box. Include the names of the companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your face in the video. As a reminder, please take the online Learning Cum Evaluation Test exercise, or OLETE, for mastery of learning and have a perfect score to get a certificate. I have placed the link in the chat box as well as in the Facebook Pep Talk page and also the group. And here is a sample of the certificate of commitment and accomplishment after you have achieved a perfect score in the OLETE. Okay. Again, as a reminder, if you have accomplished 50 OLETE, or if you have gotten 50 OLETE certificates, that would entitle you to a 1 voucher for free ROJoson telemedical consultation. So let's now have a group picture taking before we start in 2 minutes. Please show your face in the video. Okay. Ready? Please show your face. Some more. Please show your face. Chris, Adela, 2 more. Jackie Tong, Janet Uy. Okay. 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 Okay, so we will have the first page first. Page 1, 1, 2, 3. Then page 2. One, two, three. Okay. Let's do it. Okay, we'll start. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I already completed the core course on October 9, 2021. From October 23, 2021, that's today, onwards, I will be tackling health disorder and health issue courses. This may take about 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in the Development of Cancer. This is part of the cancer course. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities in the development of cancer as a health disorder or medical disease. Let me define some of the terms in the title. Fundamentals just mean the basic principles, the foundation, and the basis. Generalities, the majority, not all, not detailed, not specific. Because of the time constraint, I won't be able to discuss everything, just the generalities. And then when you say development of cancer, the appearance or growth of the cancer. The contents of this pep talk will be what is cancer, what are the different types of cancer, what are the possible theorized causes of cancer, what are the behaviors of cancers, how does cancer kill a patient, can cancer be prevented, is cancer curable? Let's start with what is a cancer. Cancer is a medical disorder, a medical disease. The question is, what is the difference between disorder and disease? Are they different or are they the same? Loosely speaking, they are the same, but strictly speaking, there is a difference. Disease is a more specific term compared to disorder. Disease is characterized by specific symptoms and signs that identify it as an abnormal entity in the body, whereas disorder is any abnormality or disruption in the normal structure and or the function of the body, and not yet pinpointing to the specific entity. Thus, cancer as a disorder is an abnormality in cell growth, development, degeneration, and death. Whereas cancer as a disease, when you say cancer is a disease, it's one that is identified as an entity with uncontrollable growth of cells with potential for invasion and spread. So here is a specific definition of cancer. Cancer is a medical disease when some of the cells, some of the body cells, grow uncontrollably with the potential to invade the adjacent tissues or organs and to spread to distant tissues or organs. So this shows the cancer cells invading the adjacent tissues. And this shows the cancer cells migrating or spreading to distant organs. In this particular picture, you have a colonic cancer, cancer in the large intestine spreading to the lungs. So this is a metastasis. So with this definition, the question is this a good definition? Does it apply to all kinds of cancer? Does it hold true for blood cancers which do not form solid tumors? The answer is yes. Using leukemias as the example, leukemias, the most common blood cancers, have the potential to invade the bone marrow and then spread to distant tissues and organs like the lymph nodes, the spleen, and the brain. Before going further, let's clarify one associated term with cancer, malignant tumor, and differentiate it from benign tumor. So malignant tumor is the same as cancer, whereas benign tumor is not cancer. Malignant tumors invade and spread. Benign tumors do not invade and spread. What are the different types of cancers? It has been said that there are more than 200 types of cancers. The types of cancers can be categorized into whether they are solid or liquid, based on the organ or tissue of origin, and then based on the specific cell of origin. Whether solid or liquid cancer, cancer can be described as solid tumors. Usually there are tumors involving the organ, that's why it's called organ tumors, or liquid cancer as exemplified by the blood cancers. Both types are similar in that they are made up of abnormal cells that grow uncontrollably. Solid tumors form a mass or multiple masses, and the liquid tumors circulate around the body through the bloodstream. So they don't form a mass unless they metastasize to the distant organs. Now, based on the organ or tissue of origin, cancers can be classified as those arising from the breast, brain, bone, stomach, esophagus, lymph nodes, epithelial tissues, connective tissues, muscular tissues, and nervous tissue. Note here that no organ in the body is spared of cancer, although it's very rare to have cancers of the heart, spleen, and appendix, but cancers can still occur in these organs. Based on the specific cell of origin, examples are carcinomas arising from epithelial cells. You hear reports of adenocarcinoma, basal cell carcinoma, squamous cell, transitional cell carcinomas, then sarcomas from the muscle cells and fat cells, leukemias from bone marrow and white blood cells, lymphoma from the lymphocytes, multiple myeloma from the plasma cells, melanoma from the melanocytes, and germ cell tumor, neuroendocrine, and carcinoid tumors. What are the possible and theorized causes of cancer? Let me just say, all diseases, whatever it is, cancer or not, have underlying, antecedent, and immediate causes. And they all have predisposing, precipitating, and perpetuating factors. However, it is difficult to pinpoint the exact cause, a single cause at that, as oftentimes the cause is multifactorial. So at best, we can only theorize the possible causes and factors of diseases, including cancers. Here is an example analyzing the causes of death secondary to a heart disease. Let's start with a non-cancer disease. It's a similarity. So a patient dying from heart disease, let's say heart attack, the usual causes that you will see in the death certificate is that the coronary arterial atherosclerosis could be the underlying, and then after that, the myocardial ischemia, okay, the antecedent, and then the immediate cause of the death of the patient with heart attack is heart failure. Then for a patient not yet dying, you can also make some analysis in terms of the causes. Okay. So you can have a genetic predisposition as the underlying cause. The long-term unhealthy lifestyle could be the antecedent cause or precipitating and perpetuating factors. And then the coronary atherosclerosis could be the immediate cause of myocardial ischemia. Applying it to cancer patients, okay. An example here, okay, genetic predisposition could be an underlying cause for the cancer. Long-term unhealthy lifestyle could be the antecedent cause or the so-called precipitating and perpetuating factor. So if a patient keeps on living an unhealthy lifestyle, that is meant by perpetuating factor. And then gene mutation is the immediate cause. Another example for a cancer patient, again, genetic predisposition could be an underlying cause. Excessive exposure to radiation could be the antecedent cause or precipitating or perpetuating factor. And then gene mutation is the immediate cause. Still another example for a cancer patient. So there might be some patients with no genetic predisposition, but the underlying cause is the chronic irritation from chemicals, which now also becomes the antecedent cause or precipitating and perpetuating factor. And then the last step is the gene mutation, which is the immediate cause of the cancer formation. So the last ultimate and proximate cause of cancer is changes or mutations to the DNA within the cells. When you talk about DNA, so these are the DNA consisting of a large number of genes, okay, each of which contains a set of instructions telling the cell what functions to perform, as well as how to grow and how to divide. If there is an error in the instructions in the DNA, it can cause the cell to stop its normal function and may allow a cell to become cancerous. The three most common theorized ways by which a gene mutation can instruct a healthy cell to form cancer are the following. It allows rapid growth. So if there's a gene mutation in the so-called, this is the type of cells that is being identified, the oncogenes, now which can tell a cell to grow and divide more rapidly. So this creates many new cells that all have that same mutation. The other theorized way is failure to stop the uncontrolled cell growth. Normally, cells know when to stop growing so that you just have the right number of each type of cell. Cancer cells lose the controls that tells them when to stop growing. So a mutation in the so-called tumor suppressor gene allows the cancer cells to continue growing and accumulating. The third theorized way is making mistakes when repairing the DNA error. Okay. So normally you have DNA repair genes which look for errors in the cell's DNA and make the necessary corrections. A mutation in the DNA repair gene may mean that the other errors are not corrected, leading cells to become cancerous. So thus one can say that cancer is a genetic disease. That is, it is caused by changes to the gene that control the way our cells function, especially how they grow and divide. So what causes the gene mutations? What are the underlying and antecedent and immediate causes? What are the precipitating, predisposing, and perpetuating factors? Gene mutations can occur for several reasons. You can have gene mutations at the time of birth, or gene mutations you're born with. Okay. You may be born with a gene mutation that you inherited from your parents. But fortunately, this type of mutation accounts for a small percentage of cancers. But if this is present, then this is the underlying and predisposing cause for the cancer that might form in the future. Gene mutations occurring after birth. Okay. So most of the gene mutations occur after you're born and are not inherited. As I said, the inherited gene mutation for the cancer are not very common. A number of forces can cause gene mutations, such as smoking, radiation, viruses, cancer-causing chemicals, obesity, hormones, chronic irritation or inflammation, and a lack of exercise. So if these are present, these are called the antecedent, precipitating, and perpetuating cause. So gene mutations that you're born with and those that you acquired throughout your life, they usually work together to cause the cancer. So this is just an infographic summarizing the genetic changes in cancer. You can have heredity, ultraviolet radiation, chemicals, viruses, smoking, and uncontrolled cell divisions. What are the behaviors of cancers? When cancer develops, it has the potential to grow and invade or infiltrate adjacent organs or tissues, and also the potential to spread to distant sites in the body. The rate of growth and spread of the cancer is dependent primarily on the behavior of the mutated genes and secondarily on the presence of promoting factors in the person's body like medications and hormonal levels and in the environment like cancer-causing chemicals or radiations. A cancer that has spread from the place where it first formed, spread to another place in the body, is called metastatic cancer. The process by which cancer cells spread to other parts of the body is called metastasis. A metastatic cancer has the same name and the same type of cancer cells as the original or primary cancer. For example, breast cancer that forms a metastatic tumor in the lungs is not called lung cancer, but is called a metastatic breast cancer. How does cancer kill a patient? There are two ways, the direct cause and the secondary or indirect cause. So let's tackle first the direct causes. Cancer can kill when it invades or spread to the essential organs. Essential means important vital organs in the body like the liver, the lungs, and the brain, and stop them from functioning properly. Or the cancer can erode into major blood vessel and causing massive bleeding. It can also cause fatal pressure effect, such as on the brain, causing brain herniation. It can also cause obstruction to hollow organs, such as the intestines. As to the indirect or secondary causes, so it can kill when it causes malnutrition because of inadequate nutritional intake, probably because of intestinal obstruction or involvement, or extreme anxiety. Then it can also kill by making the patient prone to infection, bleeding due to defective blood clotting mechanism caused by the primary cancer. The next question is, can cancer be prevented? The answer is yes, but not all. Not 100% preventable. Cancer develops through multiple factors such as genetic predisposition, environmental factors including lifestyle and viral infections, and aging, that it is very difficult to identify a specific effective strategy of prevention. That's why it's not 100% preventable. There are some things that can increase the risk of cancer that we cannot change. So this includes things like getting older and the damaged DNA inherited from a parent. Another big reason why not all cancers are preventable. So this just shows the age as risk factors in DNA change, mutations, and cancer development. We see more mutations in persons who tend to have a longer lifespan or getting older. So though managing certain controllable risk factors such as your diet, physical activity, other lifestyle choices can lower your chance of developing cancer, but the sad thing is no guarantee, just best effort and best of luck. So here are some cancer prevention and mitigation tips. Don't use tobacco. Eat a healthy diet. Maintain a healthy weight and be physically active. Protect yourself from the sun. Get vaccinated. Avoid risky behaviors. Be in touch with the reliable medical information on cancer risk and prevention. Let's go through this one by one. Don't use tobacco because smoking has been linked to various types of cancer like cancer of the lungs, mouth, throat, larynx, pancreas, bladder, cervix, and kidney. Chewing tobacco has been linked to cancer of the oral cavity and pancreas. Now, even though if you don't smoke, avoid being exposed to the secondhand smoke because it might increase your risk of lung cancer. Eat a healthy diet. Eat plenty of fruits and vegetables. Maintain a healthy weight. If you choose to drink alcohol, do so only in moderation, as this type of cancer is associated with risk of cancer of the breast, colon, lung, kidney, liver. Okay, so it increases with the amount of alcohol that you drink and the length of time that you have been drinking regularly. And then limit your processed meat. So note here that women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed food have been found to have a reduced risk for breast cancer. Maintain a healthy weight and be physically active. Maintaining a healthy weight might lower the risk of various types of cancer like cancer of the breast, prostate, lung, colon, and kidney. Physical activity on its own might lower the risk of breast cancer and colon cancer. Number 4, protect yourself from the sun, primarily to prevent skin cancer. So avoid midday sun. Stay out of the sun between 10 a.m. to 4 p.m. when the sun rays are strongest. Stay in the shade, cover exposed areas. Don't be stingy with the sunscreen. Avoid tanning beds and sun lamps. Number 5, get vaccinated. So if you are at risk, so we all know that virus can cause cancer. Viral infections can cause cancer. So cancer prevention includes protection from certain viral infections. Example, if you are at risk of hepatitis B, go for vaccination because this virus can increase the risk of developing liver cancer. If you are at risk for human papillomavirus because of unsafe practice of unsafe sex, okay, you'll be at risk of developing cervical cancers and other genital cancers, as well as squamous cell cancers of the head and neck. Okay. Avoid risky behaviors. Practice safe sex to avoid HIV and HPV or human papillomavirus because these are associated with higher risk for cancers of the cervix, anus, penis, throat, vulva, and vagina, liver, and lungs. Don't share needles to avoid HIV and hepatitis B and C, as these are associated with high risk for liver cancer. The last prevention tip is to be in touch with the reliable medical information on cancer risk and prevention. As we all know, knowledge is power. So use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to prevent the controllable risk of cancer. I think this is the last question. Is cancer curable? Before I answer this question, let's have some definition of terms or concepts. When you say medical cure, it's a medical condition that is completely gone and will never come back. What happened to you? Please unmute. Please unmute. Please mute. Okay. Please mute. Okay. So for example, if you have appendicitis and doctors remove your appendix, then you can be considered to be cured because the appendicitis will not recur anymore. If you have gallbladder stones and doctors remove your gallbladder with the stones, okay, you'll be cured of the problem because there's no gallbladder to have stone formation already. So for cancers, no doctors can guarantee your cancer will not come back. In other words, no doctors can guarantee you will be cured of cancer after treatment and after any type of treatment at the moment. Why? Number one, doctors don't know everything yet about this cancer disease. The best knowledge so far is that the ultimate or proximate cause of cancer is mutation to the genes within the cells. Although there are several theories like allowing rapid growth, failure to stop uncontrolled growth, makes mistakes when repairing DNA errors, okay? But unfortunately, the exact mechanism are not yet definitely known, okay? Thus, with the promotion of targeted cancer therapies, okay, being done on molecular or gene level, at the moment, these are not yet 100% successful. The second reason for why cancer is not curable, okay, the usual cancer treatment modalities like surgery, chemotherapy, and radiotherapy are strictly speaking just treating the primary, not treating. Let me repeat. Essentially, they are not treating the primary cause of the cancer because the cause is somewhere. Okay, they just extirpate with surgery. They just kill with drugs, with chemotherapy, and they just burn the cancer with radiotherapy. Okay. So if the primary cause is still around, there's always a possibility of recurrence after treatment. Number three, no two cancers are the same. So each individual cancer possesses different biologic characteristics, even cancers of the same type. Some are slow growing, while some are fast growing. So usually the biologic behavior of the cancer is not known at the time of treatment. Only time will tell the rate of the growth and the outcome of the treatment. So after treatment, some cancer cells may remain somewhere in the body unnoticed, and patients are asymptomatic for a long time, even as long as 10 years, but can eventually grow, divide, invade, and spread to distant areas and become a nuisance, or what we call a recurrence. So this is a reason why doctors do not guarantee cure, do not guarantee no recurrence, because at the time when there are no symptoms, doctors just use the word remissions. Complete remission means tests, exams, physical exams, and scans show that all signs of your cancer are gone or are not present or are not detectable. Some doctors refer this as refer to this complete remission as no evidence of disease or NED, or no evidence of recurrence, NER. Okay? So we have to emphasize that complete remission is not equated to cure. It doesn't mean cure. Recurrence. Some cancer cells can remain unnoticed in the body for years after treatment. If a cancer returns after it has been in remission, it's now called a recurrence. And the cancer can recur in the same place it was originally diagnosed, or it can recur in a different part of the body. So up to now, there's no true cure for cancer. No guarantee it will not recur. Physicians do not talk of cure. They use the word remission if there are no signs of recurrence. But together with the patients, they always hope for a cure, especially for those cancers which are recognized, diagnosed, and treated early, and with known track record of slow growth in behavior. Okay. I'll now go to the summary and conclusion and takeaway. I have discussed all these questions that were posted. So let me just summarize each one of them or repeat some of them. Cancer definition is a medical disease when some of these body cells, and not all, some, grow uncontrollably with the potential to invade the adjacent body tissues and organs and to spread to distant tissues or organs. Okay. Okay. Again, these are the cancer cells showing invasion of the surrounding tissues. And then this just shows the tendency of the cancer to spread, okay, to a distant area. For this particular picture, the lungs, it can spread to the liver, to the brain, anywhere. Okay. Different types of cancer, more than 200 types. Okay. And the cancers are categorized into whether solid or liquid based on organ or tissue of origin and based on the specific cell of origin. Possible theories. Okay. We still don't know everything about cancer. The best knowledge is that the ultimate cause is the gene mutation. And there are several theories here that is being forwarded. It can allow rapid growth. There's a failure to stop the uncontrolled growth, and then it makes mistakes when repairing the DNA errors. That gene mutation that you are born with, so you might be born with gene mutation, and those that you acquired throughout your life, they usually work together to cause cancer. Cancer develops through multiple factors, not just one. Okay, genetic predisposition, environmental factors, including lifestyle and viral infections and aging, that it is difficult to specify the specific cause. And then the behavior, as I said, it can infiltrate the adjacent organs and tissues, and then it has the potential to spread to distant sites. How it can kill, primary causes, okay, invading the essential organs, liver, lungs, and brains, and then stopping them from functioning properly, bleeding from erosion of big vessels, brain herniation, and obstruction of the hollow organs. And then for the indirect cause, it can cause malnutrition, infection, and bleeding. Then how can cancer be prevented? As I said, yes, but not all. Not 100% preventable. The main reason is that the cancer develops through multiple factors: genetic predisposition, environmental factors, and aging, that it is difficult to identify an effective, efficient, specific strategy of prevention. And then there are some things that we cannot change, like getting older and the damaged DNA that we inherit from the parents, if that's be the case. And then the management of the controllable risk factors are just based on, it can lower your chances, but no guarantee. Best effort, best of luck. Okay. So up to now, whether there's cure, there's no true cure for cancer. Okay. Physicians do not talk of cure, they just talk of remissions. And then take away in relation to patient empowerment. So be always in touch with the reliable medical information on the fundamentals and generalities in cancer development. Okay. Knowledge gives power. So use the 4 Ks of patient empowerment like kaalaman, kakayanan, karapatan, and kapangyarihan to prevent cancer as much as possible. And in case it could not be prevented, at least to gain greater control over decisions in the management. So with that, I end this pep talk, fundamentals and generalities in development of cancer. I hope I have empowered you to have a better understanding on the fundamentals and generalities in the development of cancer as a health disorder or medical disease. So before we go to the question and answer session, as a reminder again, take the online learning evaluation test exercise or PEP for mastery of learning and have a perfect score to get the certificate. The link is in the chat box already. Okay. 50 OLETE certificates will entitle you to a 1 voucher for ROJoson free medical telemedical consultation. Okay. So with that, we will now go for the picture taking first before the open forum. Okay. Page 1. 1, 2, 3. Okay. Let me check. Page 2. 1, 2, 3. Okay. I don't think we have page 3. Okay. So the floor is now open for questions, okay, and interactions, comments, anything.